Welcome to MedMastery's Cardiology Digest, Episode 4. If you're looking for a weekly dose of the latest research findings in the field of cardiology and medicine, you've come to the right place. Don't forget to hit the subscribe button so you never miss an episode. We're Nora and Peter from MedMastery, and we'll guide you through the show. What's on our plate today, Peter?
Well, Nora, in today's episode, we're going to dive into 4 recent studies that have some significant implications for the medical field. Let's start with study number 1, which was published in JAMA Internal Medicine. The study asks an intriguing question. Can doctors actually learn something from chatbots? We'll be exploring how technology is shaping the future of healthcare and what this study reveals. Moving on to study number 2, which was published in the Annals of Internal Medicine, we'll explore the topic of perioperative blood pressure management. This study is particularly important for those in the cardiology field. Finally, we'll delve into 2 studies that were recently published in prestigious medical journals, The Lancet and Circulation. These studies examine the impact of iron deficiency in heart failure patients. As we explore the findings of these studies, we'll gain a deeper understanding of how we can better treat patients who are facing this condition. If you're interested in learning more about any of these studies, we've included links to the articles in the show notes, so make sure to check those out on the MedMastery magazine.
But before we get started, here's a quick shout out to ourselves. We are MedMastery, the Clinical Skills Academy. We offer award-winning courses on some of the most important clinical skills out there. We're talking about things like ECG interpretation, echocardiography, coronary angiography interpretation, point-of-care ultrasound, cardiac CT or cardiac MRI, just to name a few. You can access all of these courses at medmastery.com, whether you're a resident or a seasoned healthcare professional. MedMastery has something for everyone. Our courses are designed to help you hone your skills and stay up to date with the latest techniques and technologies. So if you're looking to take your clinical skills to the next level, be sure to check out MedMastery. You won't regret it. Shall we tackle our first study, Peter?
Sure, Nora. Study number 1 is a fascinating paper that compares the responses of physicians and artificial intelligence chatbots to patient questions posted on Reddit, a popular social media forum. The study, published in JAMA Internal Medicine in April 2023 by Ayers and co-workers, selected about 200 anonymous medical questions posted by members of the public in 2022 to a Reddit forum called Ask Docs. The same questions were then given to ChatGPT. A team of physicians compared the responses of actual doctors and ChatGPT in a blinded fashion. What was striking is that the evaluators preferred the chatbot responses almost 80% of the time. Interestingly, the chatbot's responses were longer, with a mean of 180 versus 52 words, and ranked higher in quality of information. Chatbot responses also showed more empathy, with a staggering 45% of responses categorized as empathetic or very empathetic, whereas only 5% of physicians' responses were categorized as such. The study has some limitations, as it says nothing about how physicians interact with their own patients and nothing about how patients themselves might react to the 2 sets of answers. Regardless of these limitations, however, the bottom line is clear. Chatbots can be trained to be superb medical communicators. This study raises a key question for us. How can we use AI to become better communicators ourselves? The MedMastery team is excited to soon offer courses focused on these topics so you can boost your clinical effectiveness with the help of AI. What's next, Nora?
Well, as you probably know, there's some controversy about whether to continue using ACE inhibitors, ARBs, and other antihypertensive drugs right up to the time of surgery. The crux of this debate lies in the findings of 2 particular studies. One is a small randomized trial published in Anesthesia and Analgesia in 2018, which suggested a higher rate of intraoperative hypotension for patients who continued on these medications. On a similar note, a larger observational study published in the New England Journal of Medicine in 2017 also indicated an uptick in adverse events when these drugs were maintained until surgery. This contentious issue has stirred up quite the conversation in the medical community. The POISE 3 trial, published in the Annals of Internal Medicine in April 2023, set out to clarify this question. It involved around 7,500 patients with hypertension from 110 hospitals in 22 countries. The patients were randomized into 2 groups, hypotension avoidance and hypertension avoidance. The hypotension avoidance group had ACE inhibitors, ARBs, and direct renin inhibitors withheld from the night before surgery until 3 days after surgery, and intraoperative mean arterial pressure was maintained at greater than 80 millimeters of mercury. Meanwhile, the hypertension avoidance group received all their usual antihypertensive medications preoperatively, and intraoperative mean arterial pressure was maintained at greater than 60 millimeters of mercury. Although fewer patients in the hypotension avoidance group developed intraoperative hypotension that required medical intervention compared to the hypertension avoidance group, there was no difference in the 30-day composite outcome. This includes vascular death, non-fatal myocardial injury, stroke, and cardiac arrest, which was found to be the same in both groups. Even when researchers considered only patients who were taking ACE inhibitors or ARBs in each group, the conclusion remained consistent. So what's the expert opinion on this trial? The authors suggest that continuing ACE inhibitors and ARBs through surgery is reasonable. So provided that your patient is not particularly prone to hypotension, it seems from this study that it's perfectly safe to continue these drugs. What's next, Peter?
We're diving into the topic of iron deficiency in heart failure patients. To gain a better understanding of this issue, we'll be taking a closer examination of 2 recent studies. The first study is called Intravenous Iron in Patients with Heart Failure and Iron Deficiency in the UK, or IRONMAN, an investigator-initiated, prospective, randomized, open-label, blinded endpoint trial. This trial was published in December 2022 in The Lancet, and the authors are Kalra and colleagues. The second study is titled Association Between Hemoglobin Levels and Efficacy of Intravenous Ferric Carboxymaltose in Patients with Acute Heart Failure and Iron Deficiency, an AFFIRM-AHF subgroup analysis. It was authored by Philippatos and colleagues and published in April 2023 in Circulation. So what did these studies reveal? Well, previous clinical trials have shown some promise for iron repletion with ferric carboxymaltose for heart failure patients with iron deficiency and reduced ejection fraction. But these 2 recent studies provide an even broader perspective on this intervention. Let's take a closer look at the IRONMAN trial. This trial included 1,137 individuals with heart failure and iron deficiency who received either usual care or an open-label infusion of intravenous iron every 4 months until their iron deficiency was corrected. After a median follow-up of 2.7 years, the group receiving iron repletion experienced fewer primary endpoint events, which were hospitalization for heart failure or cardiovascular death compared to the usual care group, although the difference wasn't statistically significant. However, when the study's follow-up was censored in September 2020 due to the COVID-19 pandemic, iron therapy was found to have a significant reduction in the risk of the primary endpoint. The AFFIRM-AHF trial, on the other hand, didn't find a significant effect of intravenous ferric carboxymaltose on the primary endpoint of heart failure hospitalization or death after an acute heart failure episode. Nonetheless, there were encouraging benefits in secondary endpoints such as heart failure hospitalization and quality of life for patients who received the treatment. In a post hoc analysis, hemoglobin levels were found to play a role in the efficacy of the treatment. However, none of the differences were found to be statistically significant. So what's the expert opinion on these findings? Well, the studies provide some evidence for the use of intravenous iron repletion in individuals with heart failure and iron deficiency. Current guidelines already recommend intravenous iron repletion in these patients, regardless of hemoglobin level. It's recommended that physicians screen for iron deficiency in heart failure patients and treat it when present.
Thanks for listening. We hope you liked the articles we picked for you today. Make sure to check us out at medmastery.com. MedMastery is the ultimate destination for anyone looking to enhance their cardiology skills. Our courses are state-of-the-art and are focused on the most important aspects of cardiology. Plus, all our courses are CME accredited, meaning you'll be learning from the best of the best. But don't just take our word for it. We're even highly commended by the British Medical Association. And here's the best part. You can try us out for free. That's right. A free trial account will give you access to the first chapter of every course. You won't find a better opportunity to take your cardiology skills to the next level. Head to medmastery.com and become an expert today. Thank you for tuning into our Cardiology Digest podcast today. Please remember to subscribe so you don't miss any future episodes. Reflecting on the wisdom of Sir William Osler, who once said, "Medicine is a science of uncertainty and an art of probability." Let this inspire us to continue seeking knowledge, embracing uncertainty, and using our skills to make the best decisions for our patients. Until our next episode, keep learning, keep growing, and remember, our patients are at the heart of all we do.